Wonderful. So everyone, thank you. I think we all know that my name is Jordan Langer and I serve as the Alumni Relations Officer for the School of Nursing. We've had a great week of presentations and just social gatherings this week, as well as some in-person things we celebrated the class with last week as well. So it's been an incredible week of celebrations for this milestone that you're all celebrating. Before we get started with our presentations, I do want to do a brief land acknowledgement, just being cognizant that the land that UW-Madison and the School of Nursing sits upon is Native Ho-Chunk land. So that has just become kind of a standard reflection that we want to start our events with. So thank you for just thinking about that tonight as we move forward. I do want to just give Danielle a quick shout out as our student ambassador and current traditional BSN student here tonight. She's helping with tech support just in case my computer were to crash or anything crazy would happen like that. So Danielle, do you want to just do a quick intro since you're new to the group here and they're new to meeting you?
Yes. Hi. Hello, everyone. My name is Danielle. I am a senior in the TBSN track here at UW. And I'm also a student ambassador. I've been a student ambassador for 2 years working with Jordan, and it's been amazing. So I'm just really happy to be here and meet all of you and excited to see this presentation.
Wonderful. Thanks, Danielle. So we do have 3 lightning talks this evening. So I will just ask that we hold all of our questions until all 3 of our faculty members have finished their presentations. That will just give us some time at the end for greater discussion and dialogue. So I would now like to introduce Linda Kautza-Kochi, who is a class of 1972 graduate. She's going to introduce our first faculty presenter for this evening. So Linda, I'll pass it to you.
Unmute. So thank you very much, Jordan. Yes, we in the committee are very excited to be here again, and we certainly hope that others from our class decide to join us, but also very happy that these presentations will later be available to others. So when the committee was trying to decide what would we like as various educational and informative moments, we all gravitated to public health. Because Danielle, you probably don't know this, but back 50 years ago, the traditional nursing program, well, that actually was the only one there was the last 2 years were actually 12-month years. So everybody went to summer school. And there was actually an 8-week rotation for public health. And even at that time, there was a separate, if you wanted to be a public health nurse, you actually applied for a separate license to be a public health nurse. And you could only get that if you went to a BSN program. So it's been my honor to serve on the Board of Visitors. And as a result, I've had the opportunity to interact with Dr. Susan Zahner on a few occasions. So it's always great to see you, Susan. So Dr. Zahner joined the faculty in 2000, and her research is focused on improving public health practice through research and workforce development. Her research focuses mostly on improving the performance of local public health systems to achieve population health improvement within communities. And recent studies have examined inter-organizational collaborative strategies in local public health and between primary care and public health organizations. And those of us who had the opportunity to work in various health systems know how important it is to be able to transition your patient back so many times and connect them with public health organizations. Dr. Zahner has many honors, as do many of the faculty at UW-Madison School of Nursing. She was inducted into the American Academy of Nursing in 2013, and she remains an active member of the Academy's expert panel on environmental and public health. And since 2014, she has served as the Associate Dean for Faculty Affairs with the School of Nursing, providing leadership and oversight to faculty affairs and infrastructure units of the school. Tonight, we will be hearing her presentation entitled Transition to Practice in Public Health. And please remember, we're going to hold our questions till we hear all 3 of our speakers. Dr. Zahner.
Well, thank you, Dr. Portu, for that wonderful introduction. I appreciate that very much. And congratulations to all of you on your 50th class reunion. It's really quite an achievement. You have been pioneers all of your careers, and it's an honor to be here tonight to do this presentation. So I'm going to share my screen, and hopefully we'll get started. So when I heard that you wanted to hear about public health, that's great, but that's really big. So I decided to focus my presentation on something that I think is really pretty exciting that the School of Nursing is doing and really innovating in across the country. And so I want to talk about transition to practice. And I want you to spend just a few seconds thinking about when you moved from being a student to being a nurse. What are some words that come to your mind when you made that transition? And I'll bet you can remember, because it's an important time in a nurse's career. So a lot of nurses will use these kinds of words when they talk about their transition. It's exciting, but boy, it's scary, it's daunting, it's unfamiliar, it's stressful, and so on. And so these are some of the words that are used by nurses during that transition period. Transition to practice is really important. It's an important period of time because nurses who have a bad experience right off the bat may very well leave the profession right away. And we've not only lost our education that we put them through, but society has lost a nurse. So it's important because of turnover. Turnover is costly. It's costly to organizations. Negative early experiences are very costly to the individual nurse as well. So those experiences that aren't supportive can really be counterproductive to the profession as well as to individuals. So nurse residency programs evolved to help ease that transition to practice. And residency programs are designed to do these kinds of things, to promote retention, to address barriers to workforce development, and to really support new graduates as they become professional nurses. So nurse residency programs, the Joint Commission first recommended the development of nurse residency programs in 2002. So many hospitals and organizations launched those programs. Maybe you were involved in the launch of some of those programs across the country. And the AACN, the American Association of Colleges of Nursing, adopted accreditation standards for nurse residency programs in 2008. So we know nurse residency programs as being sort of planned, comprehensive periods of time during which nurse graduates can acquire the knowledge and skills they need to deliver safe, quality care that meets organizational and professional standards of practice. And that's a definition from the IOM study in 2011. So studies of the impact of nurse residency programs have shown that they do demonstrate good outcomes for increasing competency for practice, increasing job satisfaction, reducing turnover, and reducing organizational costs associated. So these positive kinds of outcomes led the Institute of Medicine in their Future of Nursing report in 2011 to recommend that residency programs be expanded, that they be available to new graduates, RNs, as well as APRNs, also to nurses changing their practice area. And most importantly for this talk, the third bullet, recommending that residency programs be available in areas outside, in settings other than hospitals. So that brings me to public health. Transition to public health practice is no less fraught and perhaps even more challenging than transition to practice in hospitals, given the focus of more nursing education is on the acute care setting. Many nurses, including me, were told to work in a hospital before you go into public health. And I suspect that may have happened to you as well. So transition to public health, if it happened later and not right away. And it was not easier, since the work of public health nurses in communities not only is built on the foundation of nursing education, but it is different, and it requires knowledge and skills in public health sciences as well as nursing. So until recently, public health nurses have not benefited from public health residency programs, despite the recommendations about extending those residencies to other settings. But now I'm pleased to say there is something called the New to Public Health Residency Program, and it's been developed right here at UW-Madison. So let me tell you this story. So a few years ago, nurses in the Southeast Wisconsin region in the Milwaukee area created something called the Southeast Wisconsin Public Health Nurse Residency Program. This program was face-to-face, a series of meetings over about a 4-month period of time. And nurses in local and state health department worked together to put this residency program on. They just decided to do it, so they started. I got involved with them when, excuse me, they reached out to me to see if they could get some additional help. I happened to have a student who was an MPH student who also had been a public health nurse, and I suggested that, or actually was a current public health nurse. So I suggested that she work with them, and they worked together to create a toolkit for the program. So it was successful, but it was small. And we decided through additional conversations that we could do better. So it's kind of the Wisconsin idea. It's what we do. So we created an academic practice partnership that included local, state, School of Medicine and Public Health, as well as the School of Nursing staff to try to, we put together a grant proposal. We submitted that grant proposal and it was funded to, it's a ICTR, a dissemination and implementation grant, which really are designed to take an intervention that's already known to be successful and try to disseminate it elsewhere or adapt it in some way. So our goals with that grant were to adapt the program to be delivered in a more rural area, because we knew it was pretty successful in a more urban area, and also to extend it to not just public health nurses, but rather the breadth of disciplines that are in public health, because it's, as we know, it's a very interdisciplinary field. And those staff at health departments need to work together. So that was our grant, and we were doing great. We had a lot of adaptation work. We worked with community groups, and we were set to pilot our new model. And when COVID happened, so this was in the spring of 2020, we had to take a step back because no one was meeting in person, and certainly public health people were not interested in anything other than dealing with COVID. So we stepped back as a team and thought about it, and we talked about it, and we decided that we could use this time to really develop something that was better in the long run, that could have a greater impact for more people. And so luckily our funder, the Wisconsin Partnership Program through ICTR, was agreeable, and we redesigned our whole grant project and went back to work, to the drawing table to do something different. So that something different was developing, we designed an online national program for new to public health professionals that were based on the best practices for nurse residency programs and contemporary public health frameworks. It was very different than where we started, but we think it's oh so much better. So we launched our first cohort of residents in September of 2021, and they just graduated this week from the program. We're very excited to have our first graduates. So the Public Health Residency Program really was started by Juliana Maskey. She was the nurse in the Southeast region who spearheaded the effort there. Hannah Hayes was the nurse who was a student, an MPH student that I put in touch. And so really I credit these two women as really getting this program off the ground. They had great ideas and the determination and energy to make it happen. I feel lucky, fortunate to be able to work with them and to try to do what I do better, which is finding money, getting rid of barriers, and really help support them in creating the program. So these are our program goals, and they're the similar goals, I think, to what nurse residency programs would be: contributing to socialization, satisfaction, building confidence, building interprofessional skills, and so on. The model that we used for this residency program is called the Foundational Public Health Services model. And this is a national model. It's gained quite a lot of acceptance across the country. Wisconsin, the state of Wisconsin adopted this model in their public health system. So across the state, this is becoming more familiar and is sort of embedded into the statewide public health system. So this model drove our program design. It also drove the content and the objectives within the program, and it's driving our evaluation. So these are some key components to the program. It is a 12-month long program. It includes self-paced online learning modules that are delivered through the UW-Madison ISEP, which is the Interprofessional Continuing Education Partnership, which is a partnership of the School of Medicine and Public Health, School of Nursing, and School of Pharmacy. And it's approved for providing continuing education credits through what's called joint accreditation. So completing this course work as part of the program results in receiving continuing education credits. Also part of the program is our monthly synchronous discussions, webinars that get the cohort of residents together to talk, to discuss, to hear guest speakers, to do a whole variety of different things that's more interactive, more in the moment, and it builds on the content of the module that was released for that month. So these self-paced modules are released one at a time each month. There's also facilitated reflection. There's an evidence-based practice project that the residents complete, and we give them support on how to do that. There's a lot of networking and peer support within the program and among the residents. We have a Facebook page and a LinkedIn page, and as well as within the courses, there are opportunities to share comments and thoughts and discussion postings. And then we also identify mentors. So each one of the residents is matched with a mentor. And if you're interested in mentoring, this is an opportunity for you. But we think it's a very important part of the program, and it's one of those evidence-based strategies from nurse residencies. The online modules include a variety of different things. We do a lot of pre and post testing of knowledge. We look at, try to make them a little interactive, so there's kind of move things around and engage with the material, even though it's online. There's a scavenger hunt, so they have to go look for things in their health department, and that helps them get to know their health department, as well as then they can share information about those things with each other. Discussion posts, there might be a case study, and there might be prompts to reflect. And we actually provide each person with a journal to and encourage them to reflect on their experiences and document that for themselves. These are the topics of each of the monthly sessions and the modules. So you can see they're tied directly back to the Foundation of Public Health Services model, but they're a mix of both sort of content areas, knowledge areas that you need in public health, but also capability skills that you need to be able to apply in public health. So that it's a mix of those things across the 12 months. So these were some things that people were saying in that first cohort at the midpoint. So we got a clue then that people were pretty happy with the program and happy about the variety of different aspects of the program. And you'll see that some of these comments actually come from supervisors of the residents. So we do document who the supervisor is, and we do surveys with them at 6 months and again at 12 months, so that we can get a perspective that's not just the residents on how this person is doing in their program. If you want more information and want to go to our website, you can put your camera up to that QR code on your screen, and that will take you directly to our website. And I would welcome any feedback and comments that you have about the program. I will say that we all know that many times in public health and in healthcare in general, we fail to sustain programs that we work on and find to be successful, but somehow we fail to translate those successful projects into successful sustained programs. And we're pretty determined to sustain this program because we think it is very much needed. Funding from one of our grants, the Evidence to Implementation Grant, supported market analysis, communication development, like with the logos and things that we have, as well as financial analysis to figure out how we might best sustain the program. Through that process, it led to our decision to offer the program on a revenue generating basis. And so we have just started. We just admitted our first cohort, which will be a paid cohort. So as individuals, now we hope that most health departments will pay for their staff to go to this, but an individual could pay for it as well. But an individual model, national model, is $1,000 per person for the 12-month program. We also have a model that we call the state-based co-facilitated model. And we've been doing this, we pilot tested this model with the state of Alaska. So they have a cohort that are all public health nurses, all from Alaska. And they have a facilitator from Alaska who coordinates and works with our facilitators to provide that program to the nurses in Alaska. So their monthly synchronous seminars might be related to more specific things about their own state, for example. And with that model, we're offering it at $5,000 for a sort of startup consultation, get everything ready kind of time frame, and our co-facilitation, and then $500 per resident. They still use the same course, they still use many of the materials, but the state folks find the mentors, and they identify the residents who are going to participate in their state cohort. So we're really excited about both of these. We have the next state is already signed up, and that's going to be the state of New Jersey. And we also have the state of New Mexico, who is interested in following. So we're pretty excited about all of this, and hope that we can sustain it this way. Now, we know that a lot of public health departments run on pretty slim budgets. So we also are seeking funding for scholarships for residents. We have a HRSA grant that is pending. We hope to hear in a week or so, that would allow us to offer the program at no cost to almost 200 people over the next 3 years. So we're hoping that comes through. We also have a cohort that's going to be forming from Region 5, which are 6 states in the middle of the region. We're going to choose 6 people from each of those states, and there's funding to support those residents at no cost to them. So we're excited about those scholarship opportunities, and we'll continue to look for those. So the rest of my time, I just want to come back to public health and back to the public health workforce. We need to build up our public health system again. I think COVID has showed us how challenged we were before the pandemic, and it certainly has been a very, very challenging time during COVID. So we need to build that public health system up again, and we need public health workers who are able to do that. So we have reason to hope, I think, going forward. But the public health workforce, as I've mentioned, is struggling. These are some fairly current statistics that show that the public health workforce declined by 17% between 2008 and 2019. And more than a quarter of the public health workers on a recent survey, 2021 survey, said they intended to leave their organizations within the next year. And that was because of heavy workload, burnout, and stress, some of which certainly is related to the pandemic. Public health nurses are part of that group. Public health nurses make up 18% of the local public health workforce across the country. And public health nurses actually declined in numbers by 36% in the decade between 2008 and 2019. So only about half of the nurses currently out there working who responded to this recent survey indicated that they've only worked less than 5 years in their health department. So they're still new. And there's a lot of turnover. 23% intend to leave their position within the next year. And again, that workload, burnout, and stress. Wisconsin is certainly not immune. I happened to look back at a 2010 report of community and public health nurses from the Wisconsin RN survey, which we do when we renew our licenses, and found that there were over 3,000 community and public health nurses in 2010. It was 5% of the whole RN population. And in 2022, that's down to 4% and just over 2,500. And community and public health are combined in the survey, so it includes more than governmental public health nurses. We think from the RN survey that there are about 1,350 actual governmental public health nurses in that survey. But again, I think there are reasons for hope. The Future of Nursing report, the new report out in 2021 by the Institute of Madison, and the new essentials put out by the American Association of Colleges of Nursing for core competencies really stress increased focus on population health, social determinants of health, preparedness, and systems change and improvement, all things that are really important in public health. And I think there's new funding that may finally get to public health. Post-pandemic, the CDC is putting out major public health infrastructure grants now that include an emphasis on the workforce. Wisconsin has applied for one of these grants, and we're waiting to hear whether we get this funding. And I think that will help support local and state level public health workers. And finally, I think with education programs, we will continue to educate the public health workforce. And I think we can partner with government, with communities, and with professional associations to bring innovations like New to Public Health Residency Program forward to help be part of the strengthening of the public health system in the US for all of us. So with that hope for the future, I congratulate you again on your remarkable careers and your contributions to the public's health.